Today, we're going to talk about bruising and the type of bruising that doesn't involve some trauma. Okay. So people are getting bruising and they're like, I didn't hit myself. I wasn't abused by anyone. I didn't have any type of physical impact. So why do I have this bruising? That's the topic for today. And it's actually a very interesting topic. Now, if you look up bruising, you'll see all sorts of descriptive types of bruising that classifies bruising by size. Like a small bruise would be classified under this condition, and you have a moderately sized bruise would be this, or a larger bruise will be called something else. But that's not really the important thing about bruising. The important thing is to find the obvious cause of a bruising that's very, very common. There's rare things like leukemia, other types of cancer, blood clotting disorders, genetic disorders that could cause bruising. Certain viruses can cause you to bruise. And a lot of different medications, as their side effect, can give you bruising, like when you're on warfarin, which is a blood thinner, or certain antibiotics, or prednisone, which is steroids, or a weight loss medication called Orlistat. You can even get it over the counter as something called Ollie. And even certain types of bowel disorders like celiac or ulcerative colitis can increase your risk of bruising. A fatty liver can increase your risk of getting bruising. So what is the common thread among all of those things I just mentioned? That's the topic for today. You have this one vitamin. It's called vitamin K1. So you may already know that vitamin K1 comes from leafy green vegetables, right? That's the highest source. And vitamin K1 is also stored in your liver. And we also know vitamin K1 is part of the fat-soluble vitamins. And so the other fat-soluble vitamins are vitamin A, D, E, okay? And you also have a different form of vitamin K called K2. So we need vitamin K1 very desperately because it prevents bleeding, okay? So it helps clotting, because if you had a paper cut and you could never stop the bleeding, you could bleed to death. So the point is that vitamin K1 is a very important vitamin in relationship to survival, because we don't want any internal bleeding or external bleeding going on. Now, some people have this idea, if they consume too much vitamin K1, they're going to get extra clotting and they're going to develop a clot. That is absolutely 100% false, okay? If you get too much vitamin K1, there's a limit to how much clotting you're going to have. It's not going to be more than normal, okay? But that extra vitamin K1 goes to two other very important purposes. Number one, it's involved in a very potent anti-inflammatory mechanism. So it helps you get rid of inflammation. That's only if you have extra vitamin K1. So vitamin K1 is not just about clotting, it's also about getting rid of inflammation. Then if there's extra K1 left over, it ends up in the bowel where it's converted into vitamin K2. And vitamin K2 is vital in preventing calcification in your arteries and in your joints, and also making sure that your bones are very, very strong. And so you don't end up with soft bones like osteomalacia or osteopenia or even osteoporosis. So let's just take some of these medications for a second and just take a look at how they would deplete you of that K1. Let's take the first one called warfarin. Okay, that's a blood thinner. Well, that actually is a drug that blocks the absorption of K1 directly. Okay, and so it thins your blood. In fact, it's used as one of the poisons to kill rats, right? It's a rat poison. It blocks vitamin K2 and then they bleed to death. Of course, when someone's giving warfarin, they're not giving you massive amounts. It's highly regulated to thin the blood to make sure it doesn't clot. So this is why people on warfarin don't have a significant amount of vitamin K1, and so they might bruise. So that could be reason number one why you have bruising. Let's go to number two, antibiotics. Certain antibiotics increase your risk of bruising. Well, here's the reason. Bacteria make a secondary backup type of bile salt, okay? So your liver can make bile, but your microbes also make bile. So if you wipe out a good significant amount of your microbes, especially the ones that make bile, then you're going to have a heck of a time extracting this vitamin K1 from your foods, okay? Because bile is all about helping you pull these fat-soluble vitamins from the food that you eat. Also, these microbes have the potential to make vitamin K1 directly. So if you don't have those microbes, then you can't make vitamin K1. Not to mention, you're not going to be able to convert K1 to K2 very well, so you'll be deficient in vitamin K2. So pretty much all these medications I'm talking about also will inhibit or create a deficiency of vitamin K2 as well. Now let's take statins, okay? The purpose of a statin is to block the production of cholesterol. Now, what's this relationship between cholesterol and vitamin K1? Well, guess what bile salts are made from? Cholesterol. And if you don't have enough cholesterol, you can't make the bile salts that help you absorb the fat-soluble vitamins. This is why there's even a condition as a side effect called statin-induced calcification. Wow. So without vitamin K1 or K2, you are going to get buildup in the arteries of calcium. So it's pretty wild that you're taking this medication to reduce cholesterol to prevent heart problems, yet it increases the amount of calcium that builds up in the arteries, which will pretty much create the same thing. And I'm not telling you to come off your medications. I'm just giving you the information. But one of the side effects from statins is bruising. Now you know why. All right. What about these steroids like prednisone? What's wild about prednisone is that prednisone causes more osteoporosis than any other medication you can possibly take. So one of the reasons it does that is it blocks vitamin K1 and vitamin K2. So then you don't have the factors to make your bones really, really strong. And prednisone really destroys the gallbladder, okay? It will inhibit the bile production and increase your risk of gallstones, which, by the way, people that have gallstones also have a higher risk of bruising. And that is because you need bile salts to prevent gallstones, okay? And so gallstones are really caused by a lack of bile. And that bile is also necessary to extract these fat-soluble vitamins from your food, like vitamin K1. Then we get orlistat. Okay, it's an over-the-counter weight loss pill. So this is supposed to help you lose fat. And I'm not sure the mechanism, if it blocks fat or whatever, but it definitely lowers your bile output, okay, from your liver. And without enough bile, you're not going to be able to absorb vitamin K1, and you're going to be more at risk for bruising. I mean, even this medication has one of the side effects is increasing your risk for something called thrombocytopenia, which is definitely a disorder of your platelets that can cause bruising. Now, also, one of the side effects from having a fatty liver is bruising. And now you know why, because without a fully functioning liver, you're not going to be able to produce enough bile to, again, extract these fat-soluble vitamins. Remember when I told you where vitamin K1 comes from? Leafy greens. The question is, how much actual greens does an average person consume in America? Well, you might be surprised to find out it's only on average 1.5 cups, okay, per day. 1.5 cups. You're not going to get enough vitamin K1 from 1.5 cups. Now, your microbes can produce vitamin K1, but if there's some problem with the microbes, then you're not going to produce K1. And this is why other problems that are associated with the gut microbiome, like ulcerative colitis, celiac, also give you this increased risk factor for bruising, because without enough microbes, number one, you can't make vitamin K1, you can't convert K1 to K2, you can't make the bile salts that are necessary for the extraction of this K1 from your food. So you can see it's a big issue. Now, we talked about bruising as the primary thing with this video, but also realize that vitamin K1 has a lot to do with preventing inflammation, as well as giving you more vitamin K2, which is kind of keeping your arteries free of calcium, keeping your joints free of calcification, keeping your bones from getting osteoporosis. And also there's quite a few other symptoms that you can have. Like, for example, you can have nosebleeds. You can have more problems with varicose veins or spider veins if you're deficient in vitamin K1. So that's all interesting. It just might give you another reason to beef up, no pun intended, the amount of vegetables, dark leafy greens that you should be eating per day, especially if you have any of the problems that we talked about, especially if you're on these medications we talked about, especially if you have a fatty liver, So like parsley has probably the most vitamin K1 of any green. Then we have kale, Brussels sprouts, spinach, any of the dark leafy green vegetables. Iceberg lettuce does not have a lot of K1. Now, as far as K2 is concerned, you can get K2 from egg yolks. You can get it from animal liver. You can also get it from hard cheeses. You can get it from extra vitamin K1, if you have any extra left, that is provided into your gut, but your microbes can also make K2 directly. So this is why you can also get vitamin K2 in sauerkraut and also this fermented soy dish called natto. And of course, if you're not from a certain Asian country, you may not like that dish. So maybe you want to stick with sauerkraut. But if you have bruising in your body and you didn't have trauma, suspect vitamin K1 deficiency, but with a catch. It could be lack of bile. It could be all these other reasons that are preventing you from getting enough vitamin K1. Now, I think the next most important video for you to watch would be the one on vitamin K2. Check that out. I put it right here.